Your name for us, please.
My name is Alison Norris, Alisonnorris.
What's your title, Alison?
I'm an assistant professor in the College of Public Health at The Ohio State University.
Are you a doctor?
I am trained as a physician, and I also have training. I'm a PhD. I hold a PhD in epidemiology.
So let me ask you, why are you here this morning?
So I came here to hear the testimony this morning because I have extensive training in medicine and in public health. And so I'm concerned to hear who will be representing the state of Ohio as the director of the Department of Health. As you know, the law requires that the director of the Department of Health in Ohio have a medical degree or extensive experience in public health. Those trainings are long, serious, and quite in-depth, and it is important that our director have those qualifications. Rick Hodges does not have those trainings. He stated today that he's not a physician, he's not a scientist. He has a lot of administrative experience, and I think it will be very important that the state has the expertise that it needs to carry out the complicated medical and public health challenges that we face.
Well, what exactly does he lack, other than an MD behind his name? What difference does it make?
So the MD behind his name would stand for 4 years of very, very serious training. If he had an MPH behind his name, it would stand for 2 years of training in public health, epidemiology, and policy. If he had a PhD behind his name, it would stand for 5 or more years of training in methods and science. So it's not the letters, it's the training. There are some people who have extensive experience in public health, and they have achieved those through their work experiences. I believe that Rick Hodges has some administrative experience working with healthcare industry. I don't think it probably suffices to stand for the kind of complicated science that he needs to be able to address on behalf of the well-being of Ohioans.